It's all good, it's okay. Sometimes we make mistakes here and there. We regret the choices that we made. Luckily, we get a break and reap the benefits of decisions we decide by chance or enlightenment. By one step at a time, we'll conquer this. Talk it over, vocalize, discuss our problems. The solution resides sometimes in conversation. We had so unpacking this baggage is advantageous. These here are our choices. Sometimes we can't avoid it, but at times we enjoy it. Other times we're up with these choices.
Hey, what's going on, everybody? This is your girl, Ween. I know it's been a minute, and I appreciate your patience, but we're back. And if this is your first time tuning in, I want you to subscribe, follow, so that you'll get notifications when the new episodes are produced. And those who have heard my podcast episodes before, welcome back. Thanks for tuning in. So my special guest today is Latrice White, and she is a registered nurse here in the DMV area. And for those who aren't familiar with DMV, it stands for DC, Maryland, and Virginia. She's also a GMU alum. Go Mason! And she's currently back at Mason working on her doctorate in nursing, which will be completed in 2023. That's what's up. So, hey, Latrice, how are you?
I'm wonderful. Thank you for having me today.
Oh, I'm glad to have you here with me today. And, especially since we're talking about such an important topic, which is our health and the importance of annual exams. So let's go ahead and get started. So I guess the first question I would have is, I guess I'll give you a scenario. So I've heard a lot of people say, I don't need to go to an annual exam because, hey, I feel good. There's nothing wrong. I don't have any aches or pains. Or I don't want to go because I may hear bad news and I don't want to hear any bad news. And then the other one is like, they don't like going to the doctor. So are those some of the common things that you hear? Or are there any other, explanations as to why people don't want to seek healthcare?
Right. You hit the nail on the head. All of those reasons and some more. There's never a shortage of reasons why people don't want to come into a doctor's office or come to the hospital. So I should preface this in saying I don't work in a private doctor's office. I work in, right now, a perioperative setting. So after most people know somebody or have had surgery themselves, that person that wakes you up after surgery and gets you into the car, that's what I do right now. But on top of my experience doing that type of nursing, I've also worked in urgent care. I've worked in the emergency room. I've done a little bit of everything. I've done health fairs. You name it, I've seen it, breezed by it, said hello to it. I've been a little bit everywhere within nursing. So when it comes back to your original question, which was why don't people go see the doctor? Or why don't they want to go see the doctor? It's a combination of things. But I think the most prevalent thing that I've come across is that people don't really understand, one, why it's important, and they don't know where to go to find a provider. Mm-hmm. And with that, most people are young, healthy. We go back to Mason years. And when you're 18, 19, nothing is wrong with you. You're 18 and 19, you're like living the good life. Everything moves the way it's supposed to be moving. You wouldn't have a care in the world, so you don't really need to be seeing a doctor. And the last time you saw a doctor regularly, it was probably your mom, your dad, whoever your guardian was, taking you to see a doctor, telling them what was wrong with you, and you just showing up.
Right.
Fast forward to when you're in your 20s, you're too busy living it up in your 20s and living real life that you're not really worried about going to see the doctor unless, for most people, you need to see the doctor or you had a baby, something related to that type of issue. So I kind of think we get out of the habit of going to see a doctor when there's nothing wrong with us. And I think that's what people are mostly kind of forgetting or really don't want to talk about because they probably know somebody else that has some chronic condition. And they're like, I don't need a doctor to tell me I got that problem. They may already know they have that problem.
Right.
And they don't want to address that problem.
Right.
And that's just real life. Real life happens to us when we're in our 20s and we're eating everything that we want to. And we're also walking 6 miles a day to get around campus and to get to where we're going. It balances it out. But once we are into real adulthood and we have a job that we go to Monday through Fridays and we're feeding for ourselves in the food section, a lot of things change when it comes to our priorities and taking care of ourselves. We don't have somebody else cooking for us every day like we did when we were living at somebody's house. Now we're either learning how to cook or we're eating out every day. So we
Right.
have other issues that come with, being a little bit older and having concerns that everybody should want to be checked out regularly for. Because in reality, if you're having an issue related to having high blood pressure or having, a high blood sugar related problem, if you can feel those problems, it's really way too late. You're like far
Mm,
into your disease process. You want to see a doctor or a provider regularly because you want to make sure that these things are being addressed early on in their progress, but also before it starts making you feel a certain way.
mm-hmm. And are there
And there's a lot of
certain, oh, go ahead.
things that your primary care doctor should be responsible for that I think people just don't realize. Oh, that's where I should go to my primary care for. It's just a lack of knowledge when it comes to why you need to be going, who you need to see for what, that
Right.
type of stuff.
Right. Yeah. Cause I think a lot of people, that goes back to what you said, everyone should find a healthcare provider. I think a lot of people, like you said, aren't familiar with what each provider does. Like there's some who have a specialty in this area, and then there's the family or primary care provider that can pretty much give a general, examination and say, okay, everything looks good, but these are areas of concern that we should address. And I think a lot of people may not be familiar with that. And then on top of that, I guess some people maybe don't know where to go to find a healthcare provider. Do you run across, that issue in your field?
Oh, yeah. I was born and raised in Northern Virginia, so I have the benefit of knowing where to go in this area because I've been here for so long. But there's a lot of people that are new to this area. They may have moved here to go to college. They may have moved here after college. They may have moved here last week. Either way, you don't really know how the healthcare system works, where to go until you, one, have insurance and you need to go figure it out, or you've been around the area long enough to kind of acclimate to the healthcare access that's in your area. So what I will say about finding a provider is that a lot of times people, if you are not being proactive about your healthcare, you may just go to the provider that your insurance company tells you to go to. So depending on how you got insurance, if you have insurance, you may get a little letter in the mail that says, oh, welcome to your insurance. You can go see this doctor. They're ready to see you.
Mm-hmm.
Or they may tell you, go to this website, pick a doctor on the list.
Right.
Go see one of the people because we're going to cover them. So I think a lot of people don't realize that just because somebody tells you to go to one person doesn't mean you have to go to that person. You can go see literally anybody you want to. If you have insurance that has stipulations, you need to know what your insurance requires of your picking and choosing of a provider.
Mm-hmm.
That's easy. You can call your insurance company or you can look at the little insert that comes in your insurance package. Look at your review of your summary review will tell you who and where you can be seen. The best way to find a provider that you actually want to see, though, is to ask your family and friends. We don't do enough in our community specifically with talking about these are my health needs. This is who I go see. Oh, I'm going to go see my doctor. Oh, why are you going to see your doctor? I need to see my doctor for that. We don't really have that conversation a lot because it's a little bit taboo. But in all honesty, we really should be talking more about who we see for our medical needs with our friends and family, because you want somebody that can hear what you're saying to them when you're talking about what's wrong with you.
Right.
And there's a lot of cultural differences when you get just assigned to a provider. And that's not to say that you have to see somebody that is of your same culture. But for some people, that is important. For some people, there's a different amount of comfort you have with speaking with somebody that may understand what you're saying without you having to say it out loud all the time. I think, so currently I work for Kaiser. And within Kaiser, you get assigned a doctor, you see them, you can do a lot of things within one building. Not everybody's insurance is like that. And even within my insurance, where I can, if I don't like my provider, let's say I don't like the way he's talking to me. Maybe I don't like his shoelaces. It doesn't really even matter what the reason I don't like this doctor is. If I don't like him, I don't have to see him. I can go to some other doctor. I can switch to another building. I can go to see one of those other doctors. People have more options when it comes to who they want to be taking care of them that they should be exercising, and I don't think a lot of people know that they have those options. You got to shop around for your medical provider, just like you shop around for whoever's cutting your hair or doing your nails. You need to shop around for somebody who you're going to talk about your health needs with, because you need to have an open conversation with them about where you are in your health journey and where you want to be and how they can help you get there.
Yeah, and read the reviews. Like, you'd be surprised at how many reviews are left about these doctors in these offices. Because I know that, you know, I was trying to find a primary care provider, and I was, you know, like you said, you go to your health insurance website, you Google, you find a provider, and then you go, you know, look up their practice or the doctor to see what they're about and what their what insurance is accepted and all that stuff. And then you can like go to, what is it? I can't remember the website, but they'll have people reviewing them, and they're like, this office is horrible, the customer service is horrible, but the doctors are great. And it's like, you would be surprised at how many people speak out about these doctors' offices and these doctors. So that can be another way to be like, okay, maybe I should avoid this place and take a look at this other location instead.
There's a lot of things that people should be wanting to know. If you know that, like, my mom is the most beautiful person in the planet. I love her. But her blood pressure gets really high if she has to wait. So, and I'm talking her patients, I felt like growing up, she had all the patients. But as an adult, I'm surprised at how impatient she is when she's at the doctor's office. So she was going to this one doctor. They made her wait 10 minutes in the doctor's office lobby. And I'm trying to tell her, like, that's not that bad. 10 minutes is
that's really good, right?
Very long of a wait. She was like, no, I waited 10 minutes and I left. I called them and I told them I'm not paying for this appointment, because if I'm 10 minutes late, you charge me for this appointment. So if you're going to be late for your appointment, you need to run me my money or you need to reschedule, because I'm not waiting.
I feel her on that part.
And she told them straight up, and they were like, okay, ma'am. The next time she went to that doctor's office, she did not wait, not even 1 minute in that lobby. And it's because she was very assertive with her needs.
Right.
But not every doctor's office may be able to meet your expectation, but you can't expect them to meet your expectation if you don't tell them what you're looking for in them as a provider.
True.
And people don't understand that, you know, there's a lot that happens in the front office that's different from in the back office, meaning with what's going on with you and your doctor. Because when you're with your doctor, they want to take care of you. They don't care about what's going on in the front office, because they're trying to spend the time with the patients that's in front of them at that time. Right. So they may not know that the front office is, you know, acting crazy, or that they're not organized, or they're not responsive. They may not know all of that. But if you have a patient wait for 25 minutes in the lobby and you're not, you know, accommodating whatever their needs are, and then they get back to the doctor, how short is that patient about to be with that doctor? Like, they don't want anything to do with their practice. So that's going to be reflective in their assessment of you. You're going to be very short with your answers and questions. You're going to be just trying to get in and out of the office because you spent half of your designated time in somebody's lobby. A lot of those things with healthcare, the expectations that we have of providers and what patients should have of their providers, is not always on the same line. But that's not to say that it can't be. That just means you need to do a little bit more research. Find a provider that has a smaller practice. Or if you don't want a provider that, you know, might still operate in paper charts. They may not have electronic medical records, but they have all the availability and appointments. You have to pick and choose what you want out of healthcare, because you may not find it all in one place.
Right.
But you still need to be trying to find a provider that gives you and accommodates you in the ways that make you a more open patient, because really healthcare is a big system. The patient is really the center of this big system. So yeah, we may tell you to get in line and wait, but in all actuality, healthcare should center around the patient, and we should be accommodating what the patient needs out of this healthcare system that we've provided them with.
Yeah. So when you go to see your primary care physician for this annual exam, what are some of the, I guess, preventative screenings that they perform during this examination?
A lot of those will be dependent upon your age. You know, the older folks, they may get a few more They may have a conversation about a different types of immunizations that you don't need until you're a little bit older, like different pneumonia vaccines, the shingles vaccine, those type of things.
Okay.
When you're, in the middle, not in your 20s, not at 65, you're someplace in the middle. There's very few screenings or immunizations that you may need from your doctor. And that's what kind of prevents people from going often, is that they don't think they need anything. It's not that you don't need anything. I'm a healthcare provider. I am supposed to recommend an annual flu shot.
Mm-hmm.
I recommend that you do what you've been doing your whole life. If you've never gotten a flu shot now, whatever you've been doing, if you haven't gotten the flu, keep doing that. But if you've gotten the flu before, you know why it's important to get a flu shot. If you're around older people or babies, you should really get a flu shot, because you want to prevent those people who are at higher risk of having the bad outcomes from having the flu from getting the flu. Most healthy people will get the flu and get over it, and it's not a big deal. But you don't want to be one of those people that gives your flu to other people. So annual flu shots, it's something that everybody can consider and make an informed decision about whether or not it's good for them. Things like getting your blood sugar checked and your blood pressure checked, I think those are some of the more important reasons to be seeing a primary care doctor regularly. Most of the time in a physical exam, they will do basic labs. So they're checking your cholesterol, your blood sugar. They're checking other basic labs that just tells us if you're having an issue that we should be concerned about. And they're also going to check your basic vital signs just to make sure that your blood pressure and your heart rate are not in places where we don't want them to be. We don't want them to be super fast, and we don't want them to be super slow. We just want to make sure everybody's in the middle. But you need to be getting regularly checked. Because what happens is, if you don't go 10 years without seeing a doctor for anything other than, issues that take you to the emergency room where they are not about to check any of those things except for your vital signs. If you wait to see a doctor when you have a problem, you could go 10 years without anybody addressing a concern that you may not know you have. So things like hypertension. You're not going to wake up one day and say, oh, I feel like I have hypertension. You're not going to feel that your blood pressure is elevated until your blood pressure is like in a dangerous state of elevation. That's why it's important to see your doctor, because you want to catch it when it's just a little bit high and when it's starting to get high before you wait till it's super high to do something about it. Because when your blood pressure is super high, though you may not feel it for all this time, that's not something that happens overnight. Just like cholesterol that builds up in your heart. It doesn't happen overnight. It's from decades of eating fatty foods, of eating all red meats, of not really exercising. Those accumulations happen over time. So one thing that you do is not going to make it go away. You have to put forth effort to get your body to accommodate these things that we have exposed our body to, in lack of better terms. But those things really should be managed by your primary care doctor. And also things that, most people feel like, if I got back pain, and it's been there, I'm kind of ignoring it, but it's there, I notice it. I wonder, what's this cause of this back pain? I know, because of my work history, that people will go months with a problem like, oh, my back hurts or my knee hurts, and then end up in an urgent care or an emergency room.
They wrote it off like it was, I just slept wrong, or
You're going to ignore it and just put it off until it's like really bothering you. And then you're like, oh, this is an emergency. But you've had this for months. It's not an emergency now. It's bothersome. Yes. Somebody needs to address it. Yes. But the most appropriate person to address those things that are bothering you, but they're not killing you, is your primary care doctor. And most people think, oh, that's not what primary care is for. That is exactly what primary care is for. If it's not killing you, you need to go to your primary care doctor. There's it's a hierarchy. If you're dying, go to the emergency room. If it's something that you want to address now, but your doctor can't see it, go to the urgent care. If it's something that you've had and it's not killing you, but you just don't like it, you need to see your primary care doctor, because the answer isn't always a blood test or an x-ray or a CT or something real invasive. Most of the time, it's something really little, something that's not going to kill you, but you may want to take these other precautions so that it doesn't bother you anymore. Like take an anti-inflammatory or take a Tylenol. take some aspirin, put some ice on it, elevate it. You know, there's some other things that your primary care doctor can do to kind of work through whatever aches and pains and bumps and bruises that you have that may not necessitate you going to an urgent care or an emergency room. And that's because when you go to an emergency room or an urgent care, you're spending a lot of money, no matter how great your insurance is. It's a dollar bills, y'all. But if you go to your primary care doctor, generally it's just what your basic copay is, with which hopefully for most people is less than $20. But insurance is a whole nother story. It may be more than that, but I'm guarantee you it's less than what you're going to pay to go to an emergency room.
Yeah, for sure.
And it's going to be better care, because things like aches and pains, you do need to monitor them. You don't need to just fix it. You need somebody to make sure it's getting better. If it's not getting better, maybe you don't need an x-ray. Maybe you just need to see an orthopedic doctor. Maybe you need to see a specialist instead of getting 30 x-rays and, you know, laying up in the hospital or in the emergency room for 9 hours for your back pain.
Right. So with that being said, do primary care providers discuss like lifestyle changes with their patients? You know, for instance, if someone's saying, oh, my knees are hurting, or like you said, my back is hurting, but they're several pounds overweight, do they suggest, you know, I know they'll say you need to lose a few pounds, but do they ever refer them to someone who can assist them with that, or give them some direction in how they could go about changing their lifestyle to help with some of the conditions that they're dealing with?
If your provider is a high quality provider, they will do more than just tell you you need to lose some weight. But that is what I think the overwhelming majority of adults will say that they have heard from their provider was, oh, you just need to lose some weight. Or they don't talk about it at all. They either will not say anything at all about your weight, or they will kind of make it like an optional thing. Like, oh, you could lose a couple pounds and it might help, but you also might need a knee replacement. If somebody is telling you something as drastic as replace your knee and glazing over the fact that you could just lose some weight,
right?
You know, there's a little bit of a disconnect in what we're talking about right here. Like maybe we weren't clear about our plans, but that goes back to having a provider that understands you as a patient and not is just going to offer you a solution that doesn't really fit your lifestyle. Lifestyle interventions, unfortunately, I think healthcare now kind of puts that on the patient. Like, you know where to find information about how to lose weight and eat right. That's on you. If you go to your primary care doctor's office, a lot of times they kind of feel like, oh, they already know that. What else am I going to tell them? But in actuality, or in my reality, I think patients need some more direction about lose some weight and eat healthy. Because when you tell somebody lose some weight, one, it's not that easy. And two, it's a lot. Yeah, if I can lose some weight, like, oh, bro, how do I snap? 2 snaps or 3? Like, if it's that easy, please, everybody would do it and it wouldn't be a conversation. But when you tell somebody you need to lose a little weight, like, let's take it back a few steps and tell somebody, let's instead say, how can we incorporate more activity into your life to begin with? Where are you unable to, or what are the barriers that you're having to eating healthier? What are the barriers you're having to exercising? I don't think enough providers go into lifestyle interventions because as providers, we know we're telling you the basics and expecting you to take care of it. If we did more to encourage it and emphasize it, I think patients would see how important it is. But the thing with lifestyle interventions is that they take a lot of like self-discipline and ownership on the patient that for various reasons people may not be able to, you know, fulfill. And a lot of it, I think, is just, I don't know what I need to do. You're telling me to do something, you're giving me a big goal, but you're not giving me the necessary steps to get there. Like something simple, like if you just start with exercising for 15 minutes a day, 5 days a week, something like that is more specific than saying, oh, go exercise or go lose a little bit of weight. I don't think enough people have the bite-sized steps that you really do need to make lifestyle interventions, because it's a habit. You have to be in the habit of getting up early in the morning to exercise, or even not early in the morning, spending 35 minutes in a gym or on a exercise bike, whatever it is. That is a habit that you have to build, and you can't just jump in and out of it because it don't work. It does not work.
Yeah. habit and discipline, because motivation isn't always going to be there. So
Yes.
yeah, and
Motivation is key.
in order to see the results that you're looking for, there has to be consistency. And if you're, like you said, if you jump in and out, you're not going to ever see it.
Yeah.
So
And it's, when we go to our doctors, we talk about like, if you don't have a medical need, like if I don't have high blood pressure, I don't have diabetes, what are you talking about? They're just being like, okay, you're healthy, keep it moving. But really, your diet, your exercise, all of those things should be discussed with your doctor, because those things impact how much risk you have when it comes to these chronic conditions. And that's the conversation that not enough people understand or ever even have with their doctor, because they don't understand it enough on their own, and their doctors are not spending enough time explaining what it means when we say, oh, you're at risk for XYZ, because that dictates a lot of your preventative health screenings. It dictates a lot of how medicine happens around you. So like things like breast cancer. If you have a strong family history of breast cancer, the way that you're managed is different than somebody who has no family history of breast cancer. And that's even different from somebody who is not knowledgeable at all about their family history. So if you know nothing about your family and you know everything about your family, a doctor has to identify that we need to do something more with these two patients, because it could be a very wide range of what's going on with them.
Right.
But most people don't know to have that conversation with their doctor. Or if you're not very close to your family and you don't know that you have this much of a risk, you may not know to say that to the doctor. So if you've been estranged from your family and, every man on your dad's side died at 32 and they all had heart attacks, and you don't talk to your dad, you're walking through life real risky and you don't know it. And most people, that person may not have any symptoms that says I should be worried about this risk. But when they turn 32 and they drop dead, we all know. Oh, yeah. Well, everybody else in his family dropped dead the same way. We should have been more proactive about this early along if we had known that this was a problem that we needed to be worried about.
Yeah. Yeah. Family history does play a huge part in your I guess your health record, because, and I feel like, to me, I guess it depends on, like you said, depends on the healthcare provider. Because I feel like I go in and I fill all that information out, and then I go and I speak to the provider and they ask me the same questions. I'm like, did you even review any of the paperwork that I took time to fill out? And I'm repeating the same information again, or I'm like adding to it because that section wasn't provided for me to provide additional information. So it's just like, sometimes it just feels like a waste of time to fill out the paperwork, because I feel like you're not going to look at it anyway.
Yep. And a lot of people, it's surprising how many people will like just fill out the first couple questions and then just put like a line down it, or just skip them altogether. And you're right. Most people are overwhelmed by how much information you're asking me to only ask me again.
Right.
And especially if you're in an emergency room, you're going to tell the person at the front desk, you're going to tell the nurse, you're going to tell the doctor, and then they might ask you again to repeat it if they didn't understand and they want their colleague to hear it, they're going to ask you to repeat it again. And if you're in the hospital, it's even worse than that. You're saying your name about 1 billion times. And at the end of the day, you're like, don't ask me no more questions.
You know what? I'll just go home. I'll figure it out myself. Like I'm over it.
It seems like y'all don't know what's going on. Why are you asking me so many questions?
And especially when you're in the hospital after having a baby. Like, it seems name, birthday. I'm like, just look at my bracelet. Like,
you were just in here. I know you know my name.
You're in here every 10 minutes or so, seems like. So
when I had my first kid, they gave me Ambien, and they were like, because I got induced, they were like, have a good night rest, take this Ambien. When you wake up, you'll be trying to have a baby. Man, I took that Ambien. Every time the CA came in my room, I was like, why are you here again? Like, it made me so aggressive. I was like, I'm never taking Ambien again, because apparently all these people in the hospital, I remember telling her, like, you were just here. Why are you here again? And it's because you don't have any concept of time when you're in the hospital. There's no clocks any places accessible. 1 million people are running in and out of your room. Like, it really is the twilight zone. Like, I don't recommend anybody go to the hospital for any reason. Unless you're dying, don't go to the hospital because it's
Yeah.
terrible.
Yeah.
It's terrible.
It seemed like, just like you said, it seemed like every 10 minutes they were in there checking something, asking me something, bringing me something. And I'm just like, well, how am I supposed to rest
Yep,
if you're
all
in and
medical.
out of here, you know, or trying to give me some painkiller? I'm like, I'm good. I'm not in pain right now. I'm good. Like,
Yeah. You woke
it's
me up to
crazy.
ask me this? Oh, yeah.
Yeah, and I'm just like,
Unfortunately,
if I were to do it all over again, I would just have a home birth. I would be peaceful, just have a midwife here, and we just handle it at home. Because
yes. I highly recommend that. It's scary. It's scary because I think from the patient side, when you see all these things and you don't know what, nobody says why we're doing all this. If you just tell me why and this is what I'm supposed to expect, then I think I wouldn't be so annoyed or so like don't really want to be here or
right,
so I don't like the term aggressive, but for me, I felt highly aggressive when I've ever been in a medical situation as a patient. And it's because I know a lot because I'm a healthcare professional, but when you're on the patient side, you're still in a vulnerable position. So from the patient's perspective, I don't understand why nobody just explains. We need to verify this information. So let's not go down this list. If you said no to 50 things, I'm not about to verify your no. But the yes, it's important to verify the yes because on the paperwork, it's usually something very general like heart disease or cardiovascular disease.
right,
The details about that, which they don't ask you to write down because a lot of that gets lost in translation. But those things that they're verifying, they should be explaining why it's important to verify this specific information that are affirmed on the paperwork. And they don't. They're just like, here, let me ask you all over again instead of just having a conversation with patients. And some of that goes back to picking the right kind of provider. Because I remember one of the ladies that I had when I was pregnant with my son, she was an older Black lady. And I remember her practice was really small. It was just her and the office manager in the office when you come in for like all your wellness exams. So you go in, you give a urine sample, you go to the back, she does your blood pressure, she measures your belly, XYZ, you're done. The whole appointment takes maybe 25 minutes if you don't have a whole bunch of stuff to talk about.
right.
I loved going to that provider because it was like straight to the point. She cut out all the unnecessary stuff. In hospital systems and bigger offices, they have a lot of system things that they have to do. And that's why there's so much paperwork because they have to systemically prove that they're catching and capturing all this data and information. And it's cumbersome and it's annoying. It's necessary, unfortunately, but I think most doctors' offices should do a better job of explaining all of this unnecessariness because as a patient, I don't care about any type of data that you have to account for. All I care about is getting care. And I don't think enough people know that like half the paperwork that they ask you for, if you were like, no, I'm not filling that out, what are they going to do? They're not going to do anything. They're going to still take care of you. There's lots of paperwork that Kaiser makes you fill out when you got kids to go to like annual appointments. And it's a bunch of checklists. And I more than one time, I just didn't want to fill out the paperwork. I put one line straight down all of them. I was like, I'm done. And they never asked me about it. They didn't. I could tell nobody ever read that paperwork because nobody ever confirmed any of the information on it. So I got tired of filling it out. And that's what I'm a bad example of what you should not be doing at your doctor's office. But that's the reality of what happens when doctor's offices are not cognizant or aware of how they're making patients feel, is that it's off-putting. It rubs people the wrong way. And some people will be like, okay, I'm not going to go back to that office. Some people will be like, oh, I'm not going to go see any provider at all because they're all probably like that. You know, that's part of the problem with healthcare is that patients shouldn't feel like they shouldn't be going in because of how another office made them feel. They need to be more empowered to say, oh, look, I have a problem. I need to get it taken care of. I need to find the right person to get this done.
Yeah. So is, I guess, seeing these issues while, I guess, in school and learning about different things, that encourage you to actually seek this profession?
I feel like I've always known my whole life that I was going to be a nurse. And that was fine with me because I always felt like doctors really don't spend any time with patients. I like talking to people. I like getting down to the nitty gritty. I want to understand what's going on, and I like to understand the whys. I'm a why person. I felt like physicians specifically, they know a lot of information about how things happen, but they're not really always, they don't have the time to understand how people are. So yes, science is one thing, but understanding how people got this way is totally different. And that patient care stuff, that patient care interaction, I love that part. That's what has kept me in nursing all these years. And that's what's making me want to get a higher degree in nursing, is to really be able to more impactfully change patients more so than I was as a registered nurse. Because you can't do but so much as a registered nurse. Like, yeah, I can take care of you. I can make you feel better. I can give you all the information. But when you have more qualifications behind you, I feel like you're just able to make more impactful actions on patients. Because if I tell a patient, oh, this is me and you to the end, we're going to ride and figure out what's going on with you, you know, it's a little bit different than the nurse that may or may not be here the next time I see this doctor. Nurses come and go, and especially in the setting that I was in. I was in the emergency room and in urgent care. You're lucky if you see the same emergency room nurse the next time you come back, because hopefully you're not coming back that often.
Yeah, but true.
In that setting, that you shouldn't see them that often. In urgent care with Kaiser, you know, I see those people more often because they're it's a smaller population. But I feel like patients really everybody should have their own personal nurse. I don't know how feasible that is, but honestly, I think people need somebody that they can talk to that's able to translate it into a way that they can understand. Because I find that patients can hear a doctor talk to them. If I'm in the room, they're going to turn around and ask me some question, even if the doctor gives them an opportunity to ask a question. And some of it is that you hear him, but you didn't understand what he said. And you know you're not about to understand what he said. So you're going to wait till he leaves and ask somebody who's going to break it down for you. Because either the patient may perceive that the doctor's too busy to explain, or they don't understand, they don't know what question to ask. So they just bypass the doctor altogether, and they're more likely to ask questions to the nurse if they feel comfortable with the nurse. That level of comfort, that level of trust, you're not going to get it with providers, because think about how many providers there are out there. You see your primary care provider. If you break your back, you're going to see an orthopedic doctor. If your heart doesn't work, you're going to see a cardiologist. If your guts don't function, you got to see a GI specialist. There's all these different providers that take care of every different part of your body. And unfortunately, they don't talk to each other. If everybody had a personal nurse that coordinated this for them, things would run more smoothly, and the patient would be more empowered to understand what they're talking about. Because a lot of patients don't understand that if you have a problem with your heart and you're seeing a cardiologist and they're putting you on all these drugs can cause you to have some other problem that this cardiologist is not going to manage for you, because that's not in their wheelhouse. So let's go back to being pregnant. If you're pregnant, you got a baby growing inside you, and you start having headaches because your blood pressure is high, your baby doctor, your OBGYN, does not do anything about your headache. They're going to tell you need to see your primary care doctor because that's an internal medicine issue. All these different people are going to handle what they specialize in. In the meantime, the patient's kind of like, where am I going with all of this? I got to manage this way. I got to manage this way, but I don't understand how to do it all together. Those patients that have multiple issues or concerns, like let's say you have hypertension, high blood pressure, and you have diabetes. A lot of the management is the same, but there's still different things that you have to be worried about. And one medicine can make another one worse. And not managing your blood pressure or your blood sugar is going to affect your blood pressure. And not enough doctors can spend the time to explain to patients how delicate it is to balance all of these things. It goes back to lifestyle interventions. You can have hypertension and diabetes, and some doctor can give you medicine. If you still sit around on your couch and still eat the same diet and take these medicines, your problem is it's not going to go away, and it's only going to be marginally better. Medications, all medicines are poisons. And ask a pharmacist. If you don't believe when your doctor says that, if you don't believe when your nurse says it, ask a pharmacist. They will tell you all drugs, all medicines are poison. If you take them and you don't do the other things you need to, you're just adding poison to your body. Some people need medications to manage their chronic conditions. Don't get me wrong. Medications are poison, but some people need that poison so that their body does not kill them.
Right.
If you do not make insulin and you don't take insulin, you're going to die.
Mm-hmm.
It just boils down to that. And it seems very intuitive that people are going to be like, okay, I'll take my medication because I don't want to die. But if you have a person that has hypertension and they don't feel any problem, it's hard for them to buy into the fact that they need to take a medication to address their hypertension because they
Right.
don't feel it and they can't see it. They don't see the problem. And it's
Mm-hmm.
because no doctor has explained enough to that patient to understand why this problem is not right now is not a problem. It's going to be a problem later because the longer you don't address your hypertension, the more stress it puts on your, not just your heart, but on your kidneys, on your eyes, on all these other things that are important in your body.
Right. And those are the, hypertension, diabetes, and cardiovascular disease seem to be like the top things, especially in our community, that seem to be like really, making people really sick. And then too, like are taking people out of here, and some of these illnesses can be, now I wouldn't say reversed, but can be, I guess, alleviated in some aspects if their lifestyle, like you said, if their lifestyle changes.
Yes, it's unfortunate that all of those things, hypertension leads to cardiovascular disease. So cardiovascular disease and diabetes are the most prevalent in the Black community, but at the same time, those are the most preventable ailments that we have. Obesity, hypertension, and diabetes are the most prevalent preventable illnesses that we encounter that are disproportionately creating mortalities and increased morbidities in our community.
Mm-hmm.
And a lot of it goes to lifestyle interventions. The answer is lifestyle interventions for all of the above. For hypertension and cardiovascular disease, along with diabetes, the first primary intervention that a provider should be discussing, because it is the most important, is lifestyle interventions. But it's easy to gloss over lifestyle interventions and go straight to what other pharmaceuticals you need. Because yes, they could work fast for you. Yes, they can stop you from feeling hungry. They're going to curb your appetite. They're going to do all these things. But one, your body's not going to maintain that same enthusiasm forever. So if you have type 2 diabetes and you start taking these medications at 30 when you're diagnosed, by the time you're 40, those same medications are not still working in your body. You're either needing to take a lot more of them or you're taking additional medications because, one, they're not working in your body anymore, but also that's the nature of the disease. The way that the disease progresses is that when you have type 2 diabetes, your body stops creating enough insulin. It's creating a little bit, but just not enough to meet the needs of your body.
Mm-hmm.
If you don't do anything to decrease the needs of your body just eventually stops creating insulin altogether. So all type 2 diabetics eventually will need insulin if they do not do anything to maintain or improve their needs and their demands on their body. Enough people don't understand that. I think when you say it to some people, some ways they hear it and it clicks for them. When you just gloss over and you go into the details about it, it's easy for people to be like, okay, I'm eventually going to get to it. I'm eventually going to address it. Or something like if you're a type 2 diabetic and you are on oral medications, that's great if your blood sugar is controlled. But we wait too long to tell people that they are eventually going to need insulin, and they may want to start that sooner versus later. And it's because the longer you have uncontrolled hypertension or the longer you have uncontrolled diabetes, the more at risk you are for the things that really do matter and really will kill you. Because you could live with diabetes for 30, 40 years. That doesn't mean that you're not going to be at higher risk for having a stroke. And there's a difference between living with the disease. Like you can live with HIV. People live 20, 30 years with HIV. That doesn't mean that AIDS does not eventually kill them.
Right.
But why would you only want 20 or 30 years when you can have 40 or 60 years? You could live a lot longer with these chronic conditions if people did more to really stick to the lifestyle interventions and address all aspects of health, because you can't be physically healthy if you're not mentally healthy. And the way that people struggle with their mental health is unfortunately not as spoken about. I think a lot of times we hear people committing suicide. We hear the suicide stories when they happen, But prior to people committing suicide, we never see these people who commit suicide talk about their struggles with depression.
Right.
And that's not a requirement. Nobody is required to vocalize their story. And I do feel like it's unfortunate that more people don't understand that everybody has the same struggles, whether they talk about them or not, whether it's causing them to kill themselves or not. Everybody has the same struggles. And if you don't want to talk to your friends about it, you don't want to talk to your family about it, you really should talk to a medical professional about it, because the insight is different. And I understand that it can be embarrassing or, taboo to talk about it with your friends, but we as healthcare professionals need to do more to let people know that it's not taboo to talk about it with your provider.
Right.
Because people can do things to help you with it, because it's not okay to feel like the world will be better without you. And I think a lot of times people don't understand that the right person to talk about that to is your primary care provider, because you may not have a friend that, is able to point you in the right direction. 90% of the people I know don't have a therapist or a counselor on deck that they can call and say, oh, what do I do about this?
Right.
But a primary care provider is just another outlet where people can go to express the struggles that they have with their emotions and feel like they can get something done with it. Because it's easy to go to your church or it's go to a friend and they are kind of, I don't want to say non-caring about it, but they may be not understanding what you're really saying about when you say you're sad. Or if you tell your friend, if you tell your friend you're feeling sad, they may think you're having a bad day, but your sadness may be more than what they're understanding or they're capable of helping you out with. Whereas if you tell your primary care doctor, oh, I'm sad, they better be asking you a lot more questions about how sad you are and how we can fix this problem in a different way than maybe a friend or a parent may be able to. Because I remember telling my mom, I don't understand this about me, or when your parent gets involved, it's like that answer is
isn't that what I'm looking for?
Yeah, mom. All right, that's not the answer. But you're my mom. What am I going to say? Okay, I'll go with it.
Yeah.
We don't understand that. Like, when you're older and your parents give you an answer, you can look at it differently. When you're a child and your parents give you an answer, you take it for what it is. And you're like, all right, I just got to not be sad about it. That's the answer. Just don't be sad about it. But in real life and with age, I've come to find that it's okay to feel sad about certain things. It's okay to feel like, disconnected from this world. Those are all feelings. You're going to get past it. But when you feel like you can't get past it, you need to go to the right place to get some help, because life is life. It's rough out there for everybody.
Yeah, most definitely. And unfortunately, it looks like it's going to be that way for some time now. So, yeah, and I think it goes back to what you said. I think a lot of it has to do with it being a topic of discussion that we don't discuss in our community, or it's, the saying goes, what goes on in our house stays in our house. And I think a lot of us have kept that concept to heart and just feel like, okay, well, I can't tell anybody because, I'm dealing with it. But in actuality, it feels great to be able to talk to somebody else about it who may or may not be able to relate, but they can be there as a sounding board to kind of help you talk through the process and giving you the opportunity to find the answer for yourself. Because most of the time you already know, it's just so far deep down in you that it's, it's lost, it's buried, but they're able to bring it up and out so that you're able to overcome whatever the obstacle is.
Yeah. And therapists, counselors, they don't have there's nothing they're sprinkling on this conversation that makes it, better. Nothing that a therapist or a doctor, nothing anybody says is going to make it better. It's about getting it out of your body and being able to express yourself. I remember after I had my last one, I was breastfeeding, and I remember feeling just so overwhelmed with the whole process of breastfeeding that nobody tells you about. Nobody gave you any manuals on how to.
Yeah.
Nobody just literally, they give you a baby, you have the baby, and they're like, go.
Right.
But they don't really say like what's next. So that whole first few months after being a mom, even if you've done it before, it doesn't matter. Every time is different.
Yep.
After my third, I'm nursing, and I remember like putting it off. Like, I'm not going to feed her. I'm just not going to feed. I can't feed her right now. Like, I just could not feed her. And she wasn't crying. So I was like, I can put it off for now. And a girlfriend of mine called and she was like, what you up to? And I remember thinking, I don't want to feed this baby. And that's all I said. And I think I had went on a spiel for like 45 minutes about not wanting to feed this baby. And my baby's sitting here and she's just looking so beautiful and just sleep. And I got off the phone because she like started to wake up. And I don't remember what my friend said to me, but I remember just picking up the baby and like doing it. And it was the first time that she latched and it wasn't painful and it wasn't uncomfortable. And even now, this has been 3 years ago, and I still don't remember what she said that made me felt so confident and like I could do it. Like, But getting it out and being able to just spill my guts about how I felt about it, that was enough for me. That may not be enough for everybody. Maybe some people need more direction and need more like stepping stones, and you need more people to help you, guide the conversation so that you can get those emotions out. But just the release and the talking of things is beneficial. So if you don't have a therapist or counselor that you can go to, find a friend, find a neighbor, find a significant other. Talking about whatever you're going through, I feel like is beneficial because when you tell other people about what you're going through, I think it makes it easier for them to do the same for you, whether they've been through the exact same thing or something else.
Right.
Those conversations about how we're feeling and our emotions and health, I think are very beneficial, especially for our community.
I agree. So, we have to have another conversation, right? We're going to have a couple more conversations because you touched on breastfeeding, and we can definitely talk about that because I've had my experiences. And then we got to touch upon a few other things that we didn't get to address today. So, like I said, there's so much more that we can cover. So I'm definitely going to schedule another episode with Latrice. So if you guys have any questions or are there any other topics that you want us to cover, just message me and we'll be sure to incorporate those into the episode. Thanks so much for joining me today and providing us with some enlightening and beneficial information. Much appreciated.
Thank you for having me. This is great.
So you'll be back for a few more episodes. So, okay, if you haven't found a healthcare provider, please do and schedule your annual exam. Let's make sure that we are healthy and well. In case no one has told you today, you're beautiful, loved, and you're worth it. Until next time.
It's all good, it's okay. Times we make mistakes here and there. We regret the choices that we made. Luckily, we get a break and reap the benefits of decisions we decide by chance or enlightenment. But one step at a time, we'll conquer this. Talk it over, vocalize, discuss our problems. The solution resides sometimes in conversation. We had so unpacking this baggage is advantageous. These here are our choices. Sometimes we can't avoid it, but at times we enjoy it. Other times we're up with these choices.